Given the situation right now with the coronavirus, Dr. Curnew's office is currently closed for patients coming in. In this video, Dr. Curnew will discuss how to book a phone appointment if you need a checkup or prescription refill. This video will also discuss how to prepare for a phone appointment if you already have one booked. If you had an appointment coming in the next few weeks, you may have received a call from our office indicating that the appointment was canceled. If this is the case, we will be calling you for a phone appointment in place of your in-person appointment. Please watch this video in order to prepare for that upcoming phone appointment. The form displayed in this video is available on our website at drcurnew.com, and we will also be sending it out via newsletter if you are signed up. Please use it to prepare for your appointment. All in-person workshops are also canceled at the clinic for the time being. Volunteers are currently preparing online video workshops that you can watch from home. We are also making a series of Google Books available online for your access. Remember to be sure to maintain physical distancing. Avoid contact with other people, keeping at least 2 meters or 6 feet of distance. If you have any questions, please email drcurnew232@gmail.com. Thank you.
Are you calling from home? So things have changed over the last little while. So we have to think about new ways of being healthier. And right now, I'm healthy. I hope you are too as well. I would never have predicted the virus to be what it is today. I don't know what the future holds, but I do know is that always trying something new. So what we're going to start off with is virtual care, partnerships in health. So I want to thank Paul for making this recording. I thank Zoya and Rachel for helping make this forum and help editing. So what we're going to do is that normally I have a busy waiting room. Right now the waiting room is empty, and what we're going to do when it's safe is to move people back to come to see us. I don't know when that's going to be, and obviously there'll be a new format. We'll apply all these rules about being about 6 feet, and we'll have less patients to deal with in the office. But right now, how we can help is to work through telephone. So right now I'm on my cell phone, and I can call you. And I'm out living in the country right now, and so the best times when my internet works is first thing in the morning. So we have step 1 here. It says arrange a phone conversation with Dr. Curnew. So we have a new email address. It's drcurnew@232@gmail.com. And this is actually something that Jen, as you know, works behind the scenes. She keeps us going. She's the office manager. She's managing the phones, but also too, I think we're going to try to communicate through email. So again, the email address is drcurnew232@gmail.com, all lowercase, no spaces. And I want you to pick a date or two or times that we can call you. I'm an early morning riser, and this says starting at 7 o'clock in the morning, but if you want to start at 6:30, I'll start at 6:30. And then we're going to be going through our list and calling you. So you might get a call from myself. Right now you might get through my cell phone, and on my cell phone it actually has my wife's name, Carrie Gibbs, as the person there. I think I guess our Rogers account is under her name. So what I want you to do is work together and basically print your name, your date of birth. If you'd like your healthcare number, would be ideal. So you want to make sure that when I contact you, or we're talking to you, or myself, or one of my part of our team, that we're talking to the right person. So date of birth, healthcare number, and name are necessary. Certainly, your name and date of birth would be ideal. And how to get a hold of you. And so we're going to be using our website, drcurnew.com. We're going to use Twitter, Facebook, and probably YouTube to get some information to you. So having your email address is a good idea, and obviously your phone. Now, it's interesting when I've called some people up, one lady thought I was a fraud trying to sell her something. one other person thought I was pulling a joke on him. It was his friend calling him. So I'm really going to call you. I'm really going to call you up, or my team will call you up too as well. Um, now, so step one is knowing when we're going to be contacting you. And I suggest communication. The best way right now, if you have email, is to communicate through the email address as drcurnew at 232gmail.com, and put all your concerns of this and follow this template. Step two, after we know when we're going to be talking to you and who we're talking to you, is it's time to monitor yourself. So it's interesting when I call people up, my first question is how you're doing, and after introductions is that, are you monitoring your blood pressure and your heart rate? And it's interesting is that many people have a blood pressure machine, but they're not using it. When you come to a hospital, you come to a doctor's office, we often do vital signs. And vital signs include blood pressure. Remember, measure your blood pressure at rest. It's best to do 3 recordings of your blood pressure. And it's the average blood pressure that's important and in a relaxed state. So please measure your blood pressure, and certainly um, there are links on how to measure blood pressure, but measuring is a great idea. One of the things that most people are not aware is that their heart rate. So what is your pulse? Some people have a Fitbit to give you your average. And as you know, blood pressure and pulse will vary quite a bit. Weigh yourself. Weigh yourself for a number of reasons. So during this new uh, virus situation, I've actually lost a little bit of weight. One of the things what I'm doing is that I'm eating healthier, and I thank Carrie, and here's some beans, some lentils. So go ahead and prepare healthy recipes. We're going to hopefully use this opportunity to be healthier for some of us. Yes, we're all under stress, and some of us under stress will actually gain weight. Some of us will lose weight. And to me, how to make this work better and how to control your weight is important. So I'm recommending that you weigh yourself 3 times a week. I'm weighing myself every day right now. So please get your vital signs first. Number 3, after your vital signs, and one of the things before I forget is that what's become available is these oximetry probes, and they're sometimes used in hospitals. So you can look into whether or not you want to measure your oximetry. I was just speaking to one of our patients, and he went through Zellers, and he has an oximetry probe, and he realizes oximetry was over 95%. That just tells the amount of oxygen in the bloodstream is important. Now, after the vital signs, after we start our conversation, is that medications. So I'm getting a lot of prescription renewals that we need to fax in. So right now, we're not in an opportunity to actually write prescriptions. We can actually fax in prescriptions. So first of all is, what medications are you taking? Fill it out. Make sure you write that down. When we're contacting you, make sure you have all the right pills in front of you. And very important, have you changed any of your medications? And are you taking them? And I know that we all make mistakes, and we're not always totally honest. The numbers say this is that many people will stop their preventive cholesterol, blood pressure pills. They won't take them properly. It's time to be open, honest, knowing exactly what you're taking, why you're taking. Statements like, I gave you that last time, lead to medication error, and thousands of people die from that on a regular basis. So we're now in a situation where you should know what your medications are, why you're taking your medications, and we'll work together on that. And we're going to open up to you, and I'm very proud of this. We've been working on books for 25 years, and we have the 30 days to healthier you. For those that have it, take the next 30 days to be healthier. For those that want to read more, and getting good information is tough. And we're going to open up. We've done something on the Google Hard Drive. We have thousands of pages of medical information, lifestyle changes, disease states from cardiovascular disease. And we have actually a long chapter, which is hundreds of pages on medication. So we're going to open it up to you. So one of the things is, know why you're taking your medications. And very important is how many refills and when you're going to run out. So many people will start running out of pills. And if you're running out of pills, have your pharmacist fax the office, um, and we'll get in contact with you, verify what you're taking. If you're taking a blood pressure pill, well, we need to know what your blood pressure is. If you're taking a blood sugar pill, diabetes pill, we should know um, what your blood sugar is for hemoglobin A1C. If you're taking a pill for congestive heart failure or for COPD, got to know what you're taking, why you're taking. It's important to know pharmacy, your address of the pharmacist, the name of the pharmacist. I'm sorry, I don't really, more importantly, the address of the pharmacy and the fax number of the pharmacist if you have it. Now, we have a list of most of the pharmacies readily available, and starts off with the address. And then we can look up the fax number. If you have that information, it's often on your prescription bottle, put that in there. It's very important. Of course, if you don't have a regular pharmacist, our office is in the Shoppers Drug Mart Plaza, and our local pharmacist is very happy to help you in any way possible. So that's another default, but certainly be involved in knowing what medications that you're taking. Now, step 4 will be, what are your health concerns? Are you feeling good? Are you scared? One of the things that I realize is that Eric and others have taught me that most of us have between 60 to 8,000 thoughts that pass through our minds most days. And most of those thoughts are unpleasant, they're stressful. And right now, when my mind wanders quite a bit. I worry about you as my patients. I worry about my office staff. I worry about the world at this point in time. And so there's a lot of unpleasantness going around, and so you want some degree of stress to get things done, but too much can be counterproductive. And to me, is that how are you dealing with the situation? You've heard all these rules about social distance, but getting your exercise is important. Knowing your health concerns. So to me, is that write down some of the things that are important to you. Are you feeling good? Are you taking your medications? Are you making some of the lifestyle changes? Are you having chest pain? So one of the things is that saying statements like "it's the same as last time my chest pain." Well, that's good to know it hasn't changed, but heart pain, we have to be detectives, because what's going on right now is that if you're having a tightness in your chest that's coming on with exertion, relieved by rest, lasting from about 30 seconds, that's a classic description for blocked arteries called angina. So we need to know about that. If I'm getting this chest pain every time I watch TV, and things are going on, that could be related. And so that's important. So descriptions of chest pain, if that's bothering you, how often it's happened. It hasn't changed. I get this chest pain been having for the last 5 years that comes on with activity. Hasn't changed very much. That's important to know, and that's realizing it's in a stable position. Things like stress tests help us determine how severe it is. Now, right now, because this virus is going on, we can get the common cold. The common cold is, you have a stuffy nose, and you might just feel unwell and cough and not come up any real spit in there. And that's basically called the common cold that we have. Influenza usually hits you like a brick wall. You get fever, you feel unwell, and it's much more sick. The coronavirus is another version of a viral illness, and you have to, and one of the incubation period varies, but for after contact with someone between 2 to 3 days, and by 5 days, if you've made contact and you got the coronavirus, 50% of people have developed symptoms if they're going to have symptoms. And by day 10 or so, over 90% of people will have the symptoms from the coronavirus. Now, that's information as of today. Information is changing. Um, what we're going to do is send you some links. I just was listening to a video by Eric Topol, who's very much a guru of modern day medicine about technology, and I love what he has to say. So take a look at that link. For instance, the virus stays in the air for a few minutes for most people, and stays on things like cardboard and plastic for about 3 days. So one of the things that people are going to worry about is, should I wear a mask? Well, what's more important, this mask or this bar of soap? I would argue this bar of soap is the most important thing you can use. So wash your hands. You hear this, wash your hands on a regular basis about 6 times a day. Eat your fruits and vegetables, 6 to 10 servings of fruits and vegetables, and wash your hands on a regular basis too as well. And the mask rules basically should be for the healthcare providers, people that are treating you. Um, and so, you're allowed to have shortness of breath because you have underlying COPD, lung disease. Um, and to me, what I'm saying is that if I'm a smoker, we say historically every time you smoke, 5 minutes of life is lost. And as we know, is that the mortality from this virus is basically as we get older. Once you're the age of 60 years of age, your mortality goes. Younger people, well, they can still die, and very unusual for that to happen. So the things to worry about is that if you do get infection in your lungs and you have lung disease, that puts you at risk. So my advice is to try to be safe in exercise using the proper restraints of, not being too close to people in quiet times. I'm lucky I'm living out in the country, so I can go in the backwoods and our property and nobody around. Uh, People are stuck in apartments that are different. So shortness of breath, fever, temperature is something you want to measure at this point in time. And if shortness of breath is increased and you're really worried, the place to be, unfortunately, is the emergency room. Having the normal shortness of breath from your lung problems are something to experience. So we're actually going to launch programs. So if you're a smoker, uh, get a Nicorette patch over the counter. There's things like Zyban and Champix that can help. But if you want to stop smoking, here's a good time to do this. So let's work on that. What other symptoms are going on? I have this new pain from my arthritis going on. That's want to know. I've changed my medications. I'm feeling good. I feel secure. Important. And I want to thank all the healthcare providers that are out there helping us on a regular basis. So right now, is it a good time to be healthier? So an apple away keeps a doctor away. So how we're getting our food right now is that we call up the food store and they load it in the trunk. And right now is that there's, do you go to the grocery store or not? It's interesting, some of the things you order you can't always get, but um, my wife has spent a lot of time cooking, and I'm eating a lentil stew that she made. And I think right now is that working on my health, I'm weighing myself, um, and I'm monitoring my vital signs. And for those who have the book 30 Days to Healthier You, try. For those that just want to uh, just avoid processed food, as you know, over 6% of calories come from processed food. And the first day when during my quarantine, I just sort of sat in the house and I only did about 2 to 3 thousand steps. Um, and then I realized is that to be to work into fitness. So my wife's out in the barn. We're lucky to be in the barn, and she's doing her yoga classes and her aerobics on the internet. Um, what I'm doing right now is I live in the country, so I can go out in the woods and do my 10,000 steps, or I can actually go there and mountain bike in the middle of nowhere. I'm pretty lucky. So remember that the virus doesn't stay very active in the air. But I'm washing my hands. I'm really going to use this opportunity. I weighed myself this morning and I weigh 173 pounds. it's interesting if I have all my clothes on in the day I can be 178 pounds and stark naked. I can scare somebody being 172 pounds. So, weigh yourself. And I'm just working on my health. So take this opportunity to avoid unhealthy foods. We're going to try to put some links on there. And I know this is a stressful time. It has to be a stressful time. So I'm washing hands. I'm trying to keep away from other people. I'm trying to avoid applying the 6 foot rule. And right now, I'm just not going anywhere. I'm on day 8 of my quarantine, and as time goes on, we're going to get ourselves uh, more and more. And so, please think about how to be healthier. And I hope you enjoy some of the different webinars we're going to try to put on, or the links we have available to you. Getting blood work. Now, most of you or some of you will have a requisition for blood work. If you have that luxury, um, make an extra couple copies of that. And right now that I have some signed ones that you may or may have, and if you need extra things measured to your blood test, let me know, and we can certainly have you add that on there. Now, I just use an example of Life Labs, but Life Labs and Dynacare, some of the bigger labs, make available to you that you can actually get all your lab results available. If you need blood work, you have to decide if it's worth going or not. And for many people who have congestive heart failure, we're looking at the kidney function. We're monitoring your potassium. Uh, it's important to know some of those values. Now, you can contact the labs, and some of them can actually have the ability to send somebody to your home and to have the blood work done, and that's a cost that you have to bear. For some people, it's just making appointments and just check online what labs are still available and still open. So right now they're doing a great effort. It's an essential service. So I think labs are a essential service. It's interesting that the liquor store and the cannabis store also felt to be essential services. So one of the things about liquid calories right now, I'm trying to use my number one beverage is just water, real water, and of course alcohol has lots of calories. One time we thought alcohol was a good food. Now alcohol for many of us is just 1 gram of alcohol is 7 calories. I don't need the calories. One gram of water is 0 calories. So water is my number one beverage, and it's a good time to reduce or stop drinking altogether. Um, Some people have a drinking problem, and if you have a drinking problem, just acknowledge that. And if you can, cut down. Let's stay in contact. Let's work together. I'm here to help, and my team's here to help. What the future holds, how long we're going to be off, I don't know. Um, Certainly, the days where we have a busy waiting room is no longer the case. I mean, I'm impressed. Countries such as Korea, for instance, they were doing, I think, over 20,000 tests a day for this coronavirus. They used apps to keep track of people, and they actually went down to shut down like China, and they've actually done a good job. Places like New York, Spain, Italy are facing a crisis. Will we face that crisis or not? I don't know. But here's what you can do: is be safe, be healthy. If you're a smoker, this is a good time to stop or reduce. We're going to put some projects and sign up things, and we're going to try to reach out to some of you as well. So please, please make it a good time to make your health as a priority. For those who have early diabetes, losing 20 pounds can put diabetes into remission. And, it's a tough, it's always tough times, but, when times get tough, when you're given lemon, make lemonade. So we're going to make some lemonade with you if you'd like. The best way to keep in contact for those that use email is Dr. Curnew at, I'm sorry, Dr. Curnew 232 at gmail.com. 232 is part of the address of our clinic. We're going to have people at the phone, and when we feel it's safe, for people to come to the office, and we'll go to that. But the decision will always be up to you. Um, so there's lots of information out there. What I find kind of concerning sometimes, if you watch CBC, CNN, you can get nervous. I think you have to get information, but also I'm reading this book. Book is called Defining Limits. This is by Dr. Dale Williams. He's a Canadian astronaut. He's done great things. This is actually a book, Hope for the Hopelessness. This is one of my heroes is Charles Moe. He actually in Kenya has founded an orphanage. I thank Trish for my Christmas book. I haven't read yet. I'm spending a lot of time a new way of delivering healthcare. So I appreciate the Ontario government has allowed us to remain in communication. I find this is a different way of communication, and whether or not it's going through a video link or just using the phone, they work and they get better. So I've gotten better at this. So maybe Paul, we can go right back to the beginning of the forum just to summarize a couple of things. Is let's work together, and the most important thing to start off with is let's find a time where we can talk. So be ready at the phone when you get the call. Pick a time. I might just look through my list of people that I'm seeing that day, and if you have an appointment that's for me, someone from my team will try to call you potentially. Number two is monitor your pressure, your heart rate, know your weight. Please know what medications and when you're going to run out. So, for instance, I'm running out of my Crestor pill in 5 days from now. I'm going to be running out of my blood pressure pill in a month from now. And I'm going to bring my diabetic pill in 2 months from now. Let's try to get all that done simultaneously. So make sure I know who your pharmacist is and their fax number, or at least their address, and we'll move forward from this. Voice your health concerns. Write down, talk about what's important to you, but do this in a concise and organized fashion. Next point, of course, is make steps to be healthy. And you need blood work or not, that's we can decide that together or not. That's something we need to make a decision. We'll be in communication. Please use the website, drcurnew.com. We're gonna change the way we deliver healthcare. And I think healthcare will be better at the end of this because we've had little bits and pieces about telemedicine. We haven't been that big in Canada, but all of a sudden things have changed. And this is an opportunity to use this technology. There's a lot of people, it's very hard to come to the office. This will be a new way of delivering healthcare. It will be a blended model, I think, once this clears between telemedicine, phone medicine, and visit medicines. Remember, if you're short of breath, you think you're having a heart attack, you're in trouble, unfortunately, call 911 or go to the emergency room. If you think you have a condition that can be managed over the phone, and I think that 70% of probably most people's problems can be managed over the phone. Do we need to do testing or not on the heart or not? We'll have to decide that together when the right time is. I wish you all well. I wish we get our cardiovascular risk factors under better control. I want to thank you all for putting your trust in us. We will continue to do the best we can under many circumstances. So I want to thank my entire team. We're all nervous, but we're all going to use this. And so remember, take the steps to be healthier. So I'm going to try to avoid processed food, an apple a day. I'm going to be washing my hands on a regular basis. The masks are predominantly for people in the hospital. And if you need to go to the hospital and you're coughing, that's the time to put on a mask. Now, I can't get masks at this point in time, and more importantly, as I can't get beans, I can be healthier. So be healthier. And thank you again.